So the Lieutenant Governor and I will have an opportunity to ask those questions of doctors. Before we begin, I want to thank the people of Rhode Island, thousands of whom have already come forward to get vaccinated. I want to thank you for doing that. I know some people are still anxious about it, and I would encourage everybody to go ahead and get vaccinated. If you have questions, let us try to answer your questions. Of course, I want to thank the National Guard and Department of Health. I was out earlier today at the Cranston-Saconaset site that the state is running to vaccinate people. It's being run incredibly smoothly. There's free parking. It's easy. It's quick. So, really want to encourage folks to go ahead and do that. We still have a limited supply of vaccine. The Lieutenant Governor and I have been working hard to try to get more vaccine allocation from the federal government. It's still really constrained, but we're doing our best to get them out the door and shots in people's arms as quickly as possible. And I also want to take this opportunity to publicly thank the Lieutenant Governor and his team. We are working in tandem together and working very well together to do the best that we can in order to get Rhode Islanders vaccinated. So with that, I want to turn it over to the Lieutenant Governor, and then we'll go ahead and get some questions answered.
Thanks, Governor. Thanks for the invite being here. You know, we do share this one thought about, getting as many shots in the arms of many people as we can as quickly as possible. And we've been, our transition has been really helped, Governor. I want to let you know that with Dr. Alexander Scott, General Callahan, we've been having early meetings every morning to get me up to speed and get me an idea of what's going on. And also your office has got me connected in with the National Governors Association. So I was on a call today with the White House, with Governor Cuomo giving the introductions. So that's been really helpful to us. So we're hitting the ground running. We're preparing for a transition. We want the people in the state of Rhode Island to know that it's a seamless transition because of the work that we've been able to do with your office, Governor, and the team that's in place. So we want to make sure that people understand that because I think that over the last 2 weeks, I've also used some of my experience as a former mayor to bring in municipalities from all around the state. We've had multiple meetings with them, and we're trying to make sure that where they can provide vaccination services, that we're taking full advantage of the skill and talent that's out there. And I think that we have a good plan to make sure that they're involved along with the state-run pods to get as many vaccinations as we can possibly into the arms of the people that live in the state of Rhode Island. So I'll leave it there, but I think that, in terms of just overall transition, I want people to know that we've talked to all your department heads, all your cabinet members. I've had personal conversation with each and every one. I believe that we're going to be hitting the ground running when the time comes. We don't know what that date is yet, but when the time comes. And you got a great team there. So the continuity and the wheels are going to keep on turning. And of course, our office and the governor's office, several of the people that have worked with you have agreed to stay. And then we'll bring our team in as well to kind of make sure that, we're doing our best to make Rhode Island this great place to live. Thanks, Governor.
Thank you. I think you've already hit the ground running. So I think it's great. Okay, so I'm going to start with the first question for Dr. Alexander Scott, and of course, Jim, pipe in at any time. But if you could, Director, just tell Rhode Islanders a little bit about how and where they can get vaccinated in Rhode Island. That is, of course, the number one question we get. Like, how do I get this vaccine? So answer that, please, for Rhode Island.
Absolutely, Governor. Wanting to make sure you can hear me good. What's important is understanding that for phase 1 of our vaccination campaign, we kept vaccinating very site-specific. We had a very targeted audience and needed to make sure that we were focused on saving lives. There was a lot of vaccination going on at hospitals and at nursing homes and other congregate settings. For the general public, which is where our vaccination campaign is headed next, there will be a few different types of places where people can get vaccinated. In this way, vaccinating will be a lot like testing. There are many different ways right now to get a COVID-19 test. However, the state has a centralized system that you can enroll in if you want to get a COVID-19 test through the state. So we want to take a similar approach. So let me start with answering the where. There are three types of places where people will be able to get vaccinated: pharmacies, local regional vaccination sites, and state-run vaccination sites. So CVS and Walgreens have already started vaccinating Rhode Islanders who are 75 years of age and older. This is a continuation of the work they started in Rhode Island, vaccinating people in nursing homes and assisted living facilities. That's the start of our pharmacies approach, and it's important to know that we intend to expand that as we go, bringing on more pharmacies with going forward. And if you think of all the different pharmacies in your local communities, we want to make sure that vaccine is accessible to you in that way. The second type of place is a local regional vaccination site. Those will include clinics running in cities and towns by cities and towns. 2 weekends ago, the cities and towns started vaccinating people who are 75 years of age and older, and they're going to continue next week. They've been doing a phenomenal job, really working side by side with our seniors, helping to walk them through the process and make sure that they have access to vaccine. Starting next week, the cities and towns are going to be getting 7,000 doses of vaccine a week total for each of their next 4 weeks for people who are 75 years of age and older. The third where is the last type of site that we have for vaccination, and that is our state-run vaccination clinic. These will be larger sites in central locations, is where we'll be doing our mass vaccinating, and our goal in those sites will be volume. Get as many people through as safely and as effectively as possible. So for example, the Dunkin' Donuts Center, which was a testing location for several months, will now become a vaccination site as we go forward. So those are the three answers to where. Retail pharmacies, a local regional vaccination site, or state-run vaccination site. In terms of how people register, let me walk through those quickly. On the pharmacy side, CVS and Walgreens, as our starting points for retail pharmacies, are handling the registration process for their stores. People who are 75 years and older can go online to cvs.com, walgreens.com to make appointments, or someone can make an appointment for them online or perhaps call as well. The second major type is our local regional approach. Cities and towns are handling the registration for those local and regional vaccination sites. And then, as I said a moment ago, the third type is a state-run vaccination system. There will be, for that, a centralized website where people can sign up to get vaccinated and have a place to call as well for people who are having trouble enrolling online or who are just not as familiar with online access. We expect to open that registration system for the state-run sites next week or the week after that. These are not open yet, again, because these are going to be mass vaccination sites. And so we want to make sure that when we open them, we have enough vaccine that's needed to really push people through effectively. Until then, vaccinating will be in more targeted venues like the pharmacies, and you can go online to register with CVS and Walgreens if you are 75 years of age and older.
Thank you. Okay, so we'll keep going. I think the question that I hear, the first question is, how do I get it? Then I also hear a lot of, I'm not sure. Is it safe? And there's a lot of myths out there. And I know a lot of people who say, I want to get it, I just don't know. So Dr. McDonald, shed some light on some of the myths and why they are myths. And what do you have to say to folks who are still afraid?
Yeah, so thank you, Governor. So let's think about it this way a little bit. You know, when we get a vaccine, what we really want to know is it safe? But we also want to know, is it effective? Well, we know it's effective. So in other words, is it worth it? Well, we know it's worth it because people are not getting the disease. We're already seeing in healthcare workers, nursing home residents, our cases are dropping. So that's some exciting data, I think. As far as safety goes, what's nice about this vaccine is, although it's new, it really isn't new technology. It's been around over a decade. And although the vaccine has an emergency use authorization, it went through the same 3 clinical trials, 3 phase 1, phase 2, phase 3, as every other drug and vaccine goes through. And we're talking about tens of thousands of people that went through the studies, which is great. And it's exciting that it's not just popular in the United States and Rhode Island, but it's exciting that the world has really embraced these 2 vaccines as well. So I think it's important to know the research was done. Some of the myths that worry me, though, is that some of the myths target where our emotions live. And I think it's really important to understand we have to separate our emotions sometimes from where our mind wants to go. I'm worried that some of the young women I know have been influenced. They've been told that, you know, if you get the vaccine, it's going to affect your ability to have a baby. What an awful lie to tell somebody, because having a baby is one of the most joyous experiences in life. By the way, I have 3 kids. I still remember very distinctly every one of their births. I tell you, so funny. I remember when Noah was born, I felt like a whole new person. It was like, oh my gosh. And it's funny, as each new child was born, you know, I didn't have to divide my love. My heart just got bigger and bigger to love each kid all the more. And it was great. And parenting is a wonderful journey. What an awful, hideous lie that's been told to some people, though. The vaccine can't affect your ability to have a baby. It can't. When I'm not working in the Department of Health, I'm a pediatrician. I am in the baby business. I love babies. Some of my favorite people on the planet are babies. I am pro-baby. So part of what I'm saying, though, is that please don't let lies distract you. And you know, part of what I'm saying, too, is that everybody in Rhode Island is important. We really want everyone to get the vaccine. You know, part of it's to relieve the public health measures, relieve restrictions, but I want to keep you healthy. So I worry about that myth about affecting people to have like a baby, or somehow it would be problematic. And that's the myth that worries me the most, because when we look at some of the folks who work in nursing homes, when I look at who didn't get the vaccine, it was people of childbearing years. So Governor, that's the myth I worry about the most. And I want to reassure anyone who's listening right now is, I have a daughter who just turned 19, but you know, if she was able to get the vaccine, my goodness, Sarah would just sign up right now and get the vaccine. So it's a safe and effective vaccine. I'm excited we've got these 2. Thank you, Governor.
Lieutenant Governor, go ahead. Maybe you could ask a question.
Well, besides being pro-baby, I like that, Doctor. But I think that the questions that are out there, again, I think that Dr. Alexander Scott really went over the strategy of the 75 and older, and then getting into the 65 and older. And you've talked about the fact that we need more vaccines, so we're going to do everything we can to get that up. But we've had additional vaccine that has come our way since President Biden has been in office. I was on a call today with the governors, and there's going to be a little bit more volume coming to all the states. So I would say that, you know, we want to make sure that the most vulnerable are getting the vaccine. You know, we got a geography strategy, and also we got a you know, a health risk strategy. And I think that if we can get the people like my mom, 92, she got a vaccination the other day. You know, somebody came, actually was able in Cumberland, they were able to come to the house. What should we be thinking next? She's like already got the calendar out, Governor, of when she gets her second dose. You know, at 28 days, she's already got the calendar out, and she knows when it's going to come. So I think that, you know, people get that first vaccination. I think that some of the things that I've learned is that we got to keep on wearing those masks. We got to keep on doing the social distances. We got to have to keep on, you know, doing the, you know, the washing the hands, which I've heard Dr. McDonald talk about over and over and over and over again. But those things are still true. And so I think that, you know, the fact is that we need to keep on wearing the mask. We got to keep on protecting our families that way. And we got to, and this to Dr. McDonald's point, I mean, these vaccinations are really important. people who are getting vaccinated right now have a sense of like, oh my God, it's almost over in a lot of ways. We know it's going to continue, but for them, the protection is there. So we got to just do everything we can to identify as much vaccine as we have in our inventory and what's in our refrigerators and get that as many arms as possible, as quickly as possible.
Yeah, you know, you just made an excellent point, and maybe Dr. Alexander Scott or McDonald could pick up on it, which is, you know, the governor's exactly right. We have to get as many people vaccinated as fast as possible. But the question is, and I hear it, do we still have to wear our masks after we're vaccinated? Do we still have to keep a social distance after we're vaccinated? Maybe you guys could talk about that.
Yeah, thank you, Governor. Certainly, it is beneficial to get vaccinated, and that's the primary message we want to encourage. We also want to help people understand what happens after that. Particularly during this time early on, we need as many people vaccinated as possible. Until we get there, it is important that we continue to wear our masks and that we continue to get tested regularly. COVID-19 vaccine is extremely effective at preventing people from getting severely ill from COVID-19. We talk about protecting the most vulnerable and preventing them from getting hospitalized and from dying. That's what the vaccine is most effective at doing. That's what we mean when we talk about the vaccine's effectiveness, keeping people out of the hospital and keeping people alive. A separate question is whether or not the vaccine will actually prevent COVID-19 infection from spreading entirely. That means understanding that you could get vaccinated against COVID-19 and you would stay out of the hospital and stay alive, but you also may still get asymptomatic infection. That means you may get infected without actually showing symptoms and still may be at risk at spreading the spreading COVID-19, the virus that causes COVID-19, to another individual. And particularly while we're continuing to make sure more and more people get vaccinated, right now it's important to continue to do those things that help us stop the spread of the virus that causes COVID-19. So it is important to make sure that you're continuing to wear your mask. It is important to make sure that you're getting tested regularly. We want to promote, we have the testing capacity, we're leading the nation in testing. You can get tested every week, particularly if you are out in the community, going to work on a regular basis, or engaging in activities that you have to engage in. Get tested. Use that as a way to protect your household. Wear your mask. Wear the most effective mask you can wear. Use that as a way to protect your household as well. As you continue to go forward, it's also important to know that if you were to have been in contact with someone who was recently positive, you would still need to quarantine and help stay at home, monitor yourself for symptoms, and make sure that whether or not symptoms develop, you are taking the steps to prevent transmission of the virus from yourself to someone else, even if it's unknowingly. A key is understanding that the vaccine may not necessarily stop someone from spreading the virus that causes COVID-19. So continue to do what's needed to protect your household. Get tested in a way that protects the people you love, ideally weekly. Wear a mask in a way that protects the people who are around you, the people you love, the people in your life. Wear the most effective mask you can, making sure it's covering your nose and your mouth, upgrading to the best mask that you are able to get access to, and wearing it as best as possible. And then keep your distance. Wash your hands. Do all the steps that we know work. It's the best way to get us going towards having a great summer in the long term as we work towards getting more and more people in Rhode Island vaccinated over time.
Governor, the General Callahan and then my good friend Tony Silva. Tony was a chief of police in my town when I was a mayor, and he runs a Cumberland emergency team that is very up to speed on vaccinations and flu vaccinations. But they're building along with the with the guidance of Dr. Alexander Scott and some of the other people that are key on your team. They're building out capacity right now. So I think that's one of the hopeful things, right? That capacity is being built out, anticipating that we're going to have more vaccine, and then people are going to be in a spot where it's going to be important what Dr. McDonald says. That at some point there's going to be a significant supply, and people have got to make sure that they understand that it's healthy to get vaccinated. But the capacity build out, General Callahan, Tony Silver in particular, working on public safety, they play key roles, as we know that all our first responders have, during this whole process.
Yeah, absolutely. I can't wait for that day to come. To that point, what would you say, Dr. McDonald, to people who, we're also in the middle of flu season. And as the Lieutenant Governor says, a month from now, 2 months from now, we hope to have more capacity. A lot of people are wondering if they've just gotten or already have the flu vaccine, should they also get the COVID-19 vaccine? How do you respond to that?
Yeah, one, thank you for getting the flu vaccine if you've done that. And by the way, we haven't seen a lot of flu in Rhode Island, so good for us. I mean, in a time where we need positive news, that's positive news. If you've gotten the flu vaccine, that's great, but you still need to get the COVID vaccine when you're ready, because flu vaccine protects you against the flu. COVID vaccine protects you against a completely separate virus. And one of the other things I think you can do, just to think in the back of your mind, is while you're waiting for the COVID vaccine, don't wait idly. You got to protect yourself, right? And your family. So I'm upgrading my mask. I'm wearing KN95 masks wherever I go. By the way, I've just discovered these from Korea. These are KF94 masks. Very similar to the KN95. Nice source control, but personal protection. Part of why I like these masks a lot is it gives me a nice seal on my face. It doesn't fog up my glasses. They go right around my ears, and they're comfortable, lightweight, and the white color, it's bland, but it's like, I'm not trying to set a fashion statement. I'm just trying to protect you and me. So things I'm saying is upgrade your mask, my friends. Upgrading your mask keeps you healthy while you're waiting for the vaccines. It also protects you against from this looming risk we have, the variants that are out there. The variants to worry about from United Kingdom, Brazil, or South Africa. So upgrade your mask, Rhode Island. That's what the McDonald family did. Thank you, Governor.
I learn something every time I listen to you.
Yeah, right. You got the K94s.
So yeah, your KF94, it's a nice product. Major online retailers have it. I'm not getting a commission. They're very affordable, by the way. They get delivered right to my house. And you know what? I think that's a great idea for people. Just upgrade your mask.
Yes, Governor, Dr. Scott Alexander Scott might want to weigh in on the new virus strain that's out there. I think that's an important piece for people to know, so they're not relaxing and they are doing all the things that Dr. McDonald just said, right? So new strain concern, right, Governor?
No, go ahead, Nicole. It's an excellent point.
Yes, thank you. I did talk about this on Thursday as well. While we are very appreciative that Rhode Islanders are doing what's needed, our percent positive has decreased to an extent that we are pleased with. We are seeing what is around us, both in the world and in our region, in neighboring states, with the information about this new variant. It's a mutated form of COVID-19. We know that can happen, but we have learned that this new variant form spreads more easily. So we haven't formally seen it here in Rhode Island yet, but because we know it is in our neighboring states and because we know how quickly it spreads, we are anticipating that in a matter of time, the next several weeks, it will be more prevalent here if it's not here already. So we want to make sure that you continue to have the tools and that you use the tools that we've made available to be ready, because that opportunity is in place. We continue to be the best state in the country in terms of testing, take advantage of it. Access portal.ri.gov, and on a weekly basis, you, your family members, your friends, your coworkers, go get tested. We have the capacity to do it all throughout the entire state. Go on to portal.ri.gov and get tested, and continue to do it weekly. If you were to test positive, or one of your family members tests positive, someone that you know, and you have symptoms, and the individual is 65 years of age and older, or have some form of underlying illness or condition, there is treatment available, treatment that is in place to help keep you out of the hospital. That's really what our big key is. What are all of the ways to keep people out of the hospital and keep them alive? So if you test positive and you're 65 years of age and older, or have an underlying health condition, talk to a healthcare provider about getting treatment for the virus that causes COVID-19. That is available to you. And then we are also rolling out the vaccination, really starting with those individuals who are at highest risk of hospitalization. Dr. McDonald talked about mask wearing. We want to continue to make sure you're wearing a mask that is as effective as possible at continuing to protect those around you, covering your mouth and nose snugly, moving away from just the cloth masks and moving towards masks that are somewhat of those higher grades that we're talking about, and just continuing to be aware of these steps you can take, washing your hands, keeping your distance, making sure that you're aware of what the ventilation is in the areas where you are, and that you're limiting how much time you're spending outside with people that you don't live with, and certainly wearing a mask anytime you are outside when you're with someone you don't live with. So these are all steps that we know can work effectively, even with the fact that these variants of COVID-19, these mutated forms of COVID-19 are out there and are likely to be here in Rhode Island as well. We can still get through it together, and our goal is to aim towards having a great summer on the other end.
That is well worth looking forward to. A regular 4th of July.
Yes.
Anyway, thank you everybody for joining the Lieutenant Governor and me. Thank you, of course, always to Dr. McDonald and Dr. Alexander Scott. I think I'm going to go out this afternoon and upgrade my masks.
Thanks, Governor.
All right, thanks guys. Stay safe in
Thank
the
you.
snow.
Take care.
Keep up the good work.